Hello, I'm Dr. Sarita. I'm an American board nephrologist practicing at Vinitha Hospitals, Chennai, in Nungambakam. Today's topic is about the pedal edema and in kidney patients, in a chronic kidney disease patients. So to begin with, let us understand what is a chronic kidney disease. Chronic word indicates that it is going on for some time. A kidney disease that is going on, that happening over the last few months or to the years, is named as a chronic kidney disease. Kidney disease is when we have a decreased kidney functions. Uh, in every area, it can be every area of a kidney function, or it could be one or two functions of the kidney that could be abnormal. So, the functions of the kidney can be primarily of five natures. One is to put out the extra fluid from the body, which is not required for the body. And second is to put out the waste products. Third, we can say is to maintain the electrolyte balance of the body, which means like a maintaining of the sodium, potassium, calcium, magnesium, things like that. And fourth would be to maintain the acid level in the body, so the breathing is maintained. And the last would be the nutrition and also the defense mechanisms, blood pressure is also important, which is maintained by the kidney. So, what are the stages of the kidney problem or a kidney CKD is normally talked about in five stages. Stage one, or maybe the definition of a kidney problem can be told as any time there is a decline in the kidney function or it is looking abnormal on an ultrasound imaging or a urine analysis is abnormal in the form of having some protein leakage or some cast or anything is all coming under chronic kidney disease. Depending on the staging, the stages are dependent on the GFR or the protein leakage. We talk about stage one when the kidney function or filtration is more than 90%, but there are other indications of kidney problem like a protein leakage or you know kidney shape is looking abnormal, like maybe one kidney is small, the other kidney is big, like that. Or stage two is when the kidney function is less than 90%, but more than 60, with or without protein leakage or abnormal problems. Number three, stage three is when the kidney function is less than 60%, but more than 30. And stage four is when it is less than 30 and more than 15. And stage five is when the life is not possible without the support from outside in the form of dialysis. Okay, that is less than 15, patient will become symptomatic at this point of time. Kidney has a great reserve, and therefore the function, even though the function keeps coming down slowly and gradually, the person may not feel anything specific of the kidney disease. So most of the symptoms of kidney problem are non-specific, and the complaints can be again in if you can go through the same functions of the kidney and how they are abnormal. So first one is again, how do we identify the kidney problem is one, if the kidney is unable to put out the extra fluid from the body will start retaining fluid, weight will go up, blood pressures can go up. Swelling initially that is noted in the legs can increase further to upper the thighs and then also sometimes around the face when they wake up in the morning. That is the fluid accumulation. And second is when the waste products are unable to put out the waste products. Urea, creatinine are the two most common, easiest waste products that we keep measuring in the blood. They go up. And as the level of the waste products increase in the body, then the symptoms can be shown on different parts of the body. And a person can be sleeping a lot, having breathing difficulty, or a chest pains, or unable to eat, like having nausea, vomiting, because of the waste products acting on different parts of the body. The electrolyte abnormalities, if they develop, like a low sodium, person can be sleeping a lot more, will be lethargic, they can even have some seizures, and their mental activity goes down. Acid base, when that gets affected, the person starts having a breathing difficulty with little bit of few minute of an exertion. The heart rate, the breathing rate goes up, and that is because they're trying to eliminate the carbon dioxide, the acid in the form of a carbon dioxide. So the breathing difficulty can also be a sign and symptom of the kidney problem. Last but not the least, when their nutrition goes down, their appetite goes down, they start losing weight and will have they will have some non-specific symptoms like body aches, tiredness, and not able to do the work effectively. So, as you have seen, one of the most important symptom of a kidney problem is pedal edema. So, what do we mean by the pedal edema? Pedal edema is a situation wherein there is a fluid accumulation in the body and it mostly in the lower extremities. That is why we say pedal. And when the fluid is accumulating, it is we see the fullness of the feet and the skin around the feet, around the ankle area, around the foot is little stretched, so you can see it a little bit more shiny. And once you put your finger on and apply pressure for 30 seconds, there will be a small dimple that comes up, suggesting that there is a fluid accumulation between the skin and the tissues below the skin, which is displaced. So that is a fluid. So this is called as a pedal edema. So pedal edema can be for different many causes like a heart problem, liver problem, low albumin. Many things can happen. But in kidney diseases, pedal edema happens mainly because of three things. One, it is because of the loss of protein. Kidney, as I mentioned to you, as it loses protein, it can be a smaller amount, it could be a larger amount. So even up to 150 milligrams of protein is okay, but anything more than that is abnormal. So we categorize that as mild, moderate, and severe. So anything more than 300 is severe. So there are people who lose up to more than 3 grams, wherein we categorize them as nephrotic syndrome. When the protein is lost through the kidney, the blood protein levels come down and the oncotic pressure in the blood goes down, because of which the fluid that is in the interstitium cannot be brought back into the bloodstream. And therefore, the blood circulation volume goes down and the kidney perceives it and starts retaining fluid in the body. And this is how, in cases where the protein loss is more, like nephrotic syndrome, the edema develops in these patients. The second way it develops is during the kidney failure. As the kidney staging or the kidney ability to function goes down, then also the fluid elimination from the kidney is affected. It is unable to put out everything. Therefore, retention of the fluid and retention of the salt happens, which will again show as the leg swelling. The third thing is also the BP medications. Most of our kidney patients will have blood pressure. So the medicines that we give them, most of the time it could be amlodipine, calcium channel blockers. So these medications which lower the blood pressure, but the way they act is by dilating the blood vessels, and that is how in a dependent areas there will be fluid accumulation. So it could also be because of the medications. So the causes of the pedal edema in a kidney patient is mostly because of protein leakage, like in nephrotic syndrome. Secondly, because of the kidney function that is declining. And the third is because of the medications. Now, what do we do? How do we treat this edema? Okay, it is important that we address it because it restricts the activity of a person, because the heaviness that they feel in their legs, and this also leads them to go to the urination multiple times at night, and that spoils their sleep, and that is how again their day-to-day activities during function during the daytime is also going to be declined. So how do we treat this? Simple, three ways. Number one, the most first thing is to be active. A person should be active throughout the day, rather than if you are sitting always in the same position and it is not somebody is not able to walk, or your work restricts you to a chair wherein you have to work with a computer for a long time. Please keep moving the feet. Therefore, whenever we walk, our calf muscles contract and they let the fluid back into the system. That is how they will prevent the fluid accumulation in the feet. So sitting for long hours is not the best. Try to avoid that, be active. But if you have to sit at one place, keep moving the feet. So that will reduce the swelling. Second thing that we can do is a dietary changes. Again, simple. Try to stick to the fresh and homemade food wherein there is no salt that is added salt required to for the taste or as a preservative. Anything that is made today but eaten few days later has salt as a preservative, and the salt is known to retain the fluid. Therefore, lower the salt, better the outcomes. In conditions wherein there's a nephrotic syndrome, low albumin, a good protein diet will help in ensuring that the protein is there, and medicines that are given to cut down the protein leakage will help in the swelling to go down. Last but not the least is the diuretics. Diuretics are the medicines which will help the kidney to put out more fluid out of the body. And these medications are the last choice. And we give them to ensure that the person doesn't keep on gaining weight. And uh, every medicine will have some side effects, like a low potassium can be expected by these diuretics. Sometimes the blood pressure goes down. So we have to be monitoring it and giving it to the person, seeing the response of the kidney urine output. And we also ask our patients to check their weight every day to see if they're losing the weight in an appropriate way and not in a drastic fashion, and to also measure their blood pressures. So this is how we can take care of the pedal edema that is coming up in the kidney patients. Finally, preventing kidney diseases is most important to avoid all these complications. So checking blood pressure, checking sugars, keeping them in control, maintaining your vaccinations to prevent the infections, and protecting the kidney, thus helps in maintaining and preserving the kidney function, maintaining its life, thus avoiding all these complications as edema will be the way to go forward. Thank you.